I read the patient's chart. All the values were within the expected range. I took the anthropomorphic measurements, and they were as I expected. There is no sign of precaution on the door. Nothing I should be concerned about. Four. Hi there.
Hi.
I'm Emily. I'm going to be your nurse today. I'm going to provide some privacy. And I'm going to do my hand hygiene. Can you confirm your name and date of birth for me?
It's Rosa, 32 years old and 1991 born.
Okay. And that's correct. I checked your wristband. I'm just going to raise your bed up. Do you know why you're here today?
Yeah. To get some treatment for my annual check.
Do you know where you are?
Yeah, Bellevue College.
Okay, good. Do you have any unexpected falls or difficulty swallowing?
No.
Okay. Any numbness or tingling in your extremities? No. Okay. And no blurred vision or anything of that nature? Okay, great. I'm going to do a head-to-toe assessment on you, and I'm going to have you do some motions and ask you some questions, if that's all right.
I'm doing it wrong.
The first thing I'm going to test is your cranial nerve number 1 olfactory. Close your eyes and tell me what you smell.
All I have is the check.
Alcohol.
Okay. That's cranial nerve number 1, olfactory. Next, I'm going to assess cranial nerves 2, 3, 4, and 6. Optic, ocular motor, trochlear, and obtuseness. So follow this with your eyes.
You guys are
Don't with your head.
I'm gonna try to
I'm assessing your 6 cardinal fields of
I
nerves.
don't want to have to worry.
I agree with you. Yeah. I would just, I can be, I don't, I'm the patient.
Great. Look over my shoulder.
I'm gonna get
I'm going to
this.
check your pupils.
Then you'll know. Like, don't tell me if I miss something because I might.
Okay. The pupils are round, equal, and accommodate to round, equal, and adjust to light and accommodation.
Yeah, that's good.
All right. Next, I'm going to assess your facial nerves 5 and 7, trigeminal and facial. Close your eyes for me and tell me where on your face I'm touching.
Yeah, that's a good idea.
Right
You get it right, man. You get it right.
Left cheek. Forehead.
Next, I'm going to assess cranial nerves 7, 9, 10, and 12.
Take your mask.
Facial, hypoglossal, vagus, and, facial, glossopharyngeal,
Up and down might be better for vision.
vagus, and hypoglossal. Sorry about that. All right, open your mouth for me and say ah. And I see your uvula is moving up and down. The mucous membranes are undamaged, no ulceration, nothing of that nature. Can you blow up your cheeks for me and raise your eyebrows and smile? Perfect.
I'm really just gonna be
And lift your chin and swallow.
on this side.
As the patient swallows, I can see that your trachea is midline.
Yeah.
I don't see anything on your neck that I should be concerned about. I'm going to check your carotid pulse.
So I got my patient assignment. I'm checking the charts for any information that would affect the head-to-toe assessment.
The pulse is regular +2, nothing bounding, anything unexpected. Turn your head this way and this way. No jugular vein distension. Next, I'm going to test your 8th cranial nerve, vestibulocochlear. Close your eyes for me and tell me which side I'm rubbing my fingers on.
Left. Right. Left.
Fantastic. Next, I'm going to test your 11th cranial nerve, spinal accessory. Turn your head against my hand. And this way. And lift your shoulders for me. Okay. I'm going to move down your upper extremities. As I do, I note the skin is intact, warm to the touch, and dry. I'm going to palpate your brachial pulses.
Okay. Do you know what month?
They are even, bilateral +2. Radial pulses, even, bilateral +2. I'm going to look at your hands. I see no clubbing. I'm going to test capillary refill. It's less than 2 seconds. Next, I'm going to do a sensation test. Do you close your eyes and tell me if you feel a sharp or dull sensation?
Disease in your family, so like heart disease? No. What about asthma?
Right arm.
What about shortness
sharp.
of breath? Do you find yourself having
Left
to change
hand
positions in
dull.
order to get comfortable?
Right thigh.
I don't know how to palpate.
Oh.
So I feel like we
Sharp.
should switch.
And dull left.
This is how we did it.
Lower left. Right sharp my ankle.
Perfect.
Okay.
All right. Make some muscle arms for me.
Okay, I'll stand.
Pull against my hands and push. And squeeze my fingers. Perfect. All right. And touch your fingers to your thumbs. Lovely. Smooth coordination. Alright, I'm going to be listening to your heart next. Do you have any history of cardiac issues?
No.
Does your family?
No.
Do you ever experience any chest pain?
No.
And are you in pain today?
No, I'm not in pain.
Okay. If the patient was in pain,
I haven't done
I would ask the PQRST questions, but they are not, so I'm going to proceed with my examination. I'm going to listen to your heart now.
I got my patient assignment. I'm checking the chart for anything that would affect the head-to-toe assessment. The
Alright. I'm going to start at the second intercostal space, right sternal border, aortic valve.
She said it though in hers, so I'm just gonna say.
No, but if
Okay.
Second intercostal space, left sternal border, pulmonic valve.
I'm not saying that word.
Third
Yeah, you
intercostal
don't have
space,
to. I just.
left sternal border, Erb's point. And in a clinical setting, I would go underneath for close, but here I'm not going to do that. Fourth intercostal space, left sternal border, and I'm going to go underneath. Fifth intercostal space, midclavicular line, point of maximal impulse, the apex of the heart, and the mitral valve. Next, I would turn this over and listen with the bell of my stethoscope to any low-pitched noises such as bruit or a murmur, but I'm not going to do that here. I'm going to listen to respiration. But first, are you ever short of breath? No. Do you have a cough? And when you do cough, what color is your sputum? Is it clear?
Clear.
Normal. Okay, fantastic. I'm going to listen to your breaths now. Every time the stethoscope touches you, take a breath in. If you start feeling lightheaded, let me know and we can stop for a minute.
Yes.
First intercostal space, midclavicular line, right side. First intercostal space, midclavicular line, left side. Second intercostal space, midclavicular line, right side. Second intercostal space, midclavicular line, left side. Fourth intercostal space, midclavicular line. Fourth intercostal space, midclavicular line. Sixth intercostal space, anterior axillary line, lateral to nipple. And on this side, sixth intercostal space, anterior axillary. Sixth intercostal space, midclavicular line. Sixth intercostal space, midclavicular line.
Today I'm going to be conducting a
And then move down to the eighth intercostal space, midclavicular line. Eighth intercostal space, midclavicular line. As I'm listening to your respirations, I note no barrel chestedness. Your respirations are even. I'm going to palpate your chest, take a breath in. Everything is symmetrical. I notice no crepitus, nothing of that nature.
Her skin on her face looks good.
Yeah, her respirations were great. No wheezing, no ronking, nothing like that. Next, I'm going to evaluate your abdomen. I notice no distension, nothing like that. Are you experiencing any nausea, diarrhea, or vomiting?
Okay.
Do you have regular bowel movements? Okay. And is your stool a normal color? Yes.
Cardiovascular or heart disease in your family.
And I evaluated your abdomen and I'm now going to listen to it, starting at the lower right quadrant. What do I expect to hear the most bowel sounds?
I can't cut it out.
And I hear gurgling. Upper right quadrant. Upper left quadrant. Lower left quadrant. I hear bowel sounds in all four quadrants. I'm going to proceed to palpation. Let me know if you experience any tenderness as I touch you. I'm going to palpate a little bit harder.
Don't make any more hand gestures.
Yeah, just keep going.
Okay, I'm
Are
done.
you experiencing any rebound tenderness?
No, I'm good.
Okay, fantastic. In a clinical setting, I would do a full urinary evaluation, and I would do a full evaluation of her perineal area. In this setting, I'm not going to do that. The patient has no catheter, she has no IV lines, no central line, nothing of that nature, no drains. Do you have any burning upon urination? Is your urine normal color and odor?
Yes.
Okay, fantastic. And you don't feel any urgency or any difficulty urinating?
No.
Nothing like that? Okay, fantastic. I'm going to move down your extremities. I note on your legs no edema. There's even hair distribution. There's no petechiae, no varicose veins, nothing like that. The skin is fully intact. Can you lift your leg for me? And this one? And this leg? And this one. Perfect. And push up against my hands and gas pedals. And can you feel me touching your feet?
Yeah.
As I'm touching your feet, I'm also checking for capillary refill, which is less than 2 seconds. I'm going to palpate your posterior tibial pulses, and they are equal, even, +2. The dorsal pedal pulses, equal, even, and +2. All right, do some ankle circles for me. Great. Next, I'm going to check your Babinski reflex. And it's normal. I see no splaying of the toes, nothing of that nature. I'm going to bring your bed down. Alright. If you kick your legs over for me and sit up, I'm going to listen to your respirations from the rear. First, I'm going to palpate. Take a deep breath for me. And I see there's symmetry and even chest rise. No kyphosis, no lordosis, no scoliosis. The spine is centered and regular, as I expected. I'm going to palpate the C7 vertebrae. Give yourself a hug. Perfect. And 3 inches to the side, roughly her first intercostal space. I'm going to listen. Breathe every time the stethoscope touches you, please. And same on the left side. And I'm going to proceed down her back in a lateral motion at 2-inch intervals. As I'm listening to her lungs, I'm not hearing any wheezing. Nothing like that. Once I reach roughly the 8th intercostal space, I'm moving over to the posterior axillary line.
That is clearly a very, very ill man.
And her breathing sounds fine. From the back, I can also see there's no skin damage, no ulceration. All of her bony prominences are protected.
Let me make sure I have it. So, I have this, I got some of these.
I'm going to have you stand up and close your eyes. I'm doing a Romberg test. I can see that there's minimal swing, probably less than an inch. Can you turn towards me and walk heel to toe to the end of the bed?
I think,
And back the other way.
I think I should
And as the
forget that.
patient turns, I observe the skin is fully
Give me a
intact.
moment, let me just
No,
get the carrot
no sores, no ulceration, nothing that I missed. Have a seat for me.
A little bit, but that's all right. Oh,
You can
this
get
is
back in
me
bed.
reminding
Are
Claire.
you comfortable? Good. Your bed is not
Okay,
been low.
so just
Your
let me know
collar
when
is
you're,
within
when
reach.
you hit record.
And I'm going to perform hand hygiene and document my findings.
All right.